The goal of this video is to review the disorders that are classified as trauma and stressor-related disorders in the DSM-5 and to discuss the characteristics that distinguish them from one another. Trauma and stressor-related disorders in the DSM-5 are interesting because they're the only disorders that require some kind of external event. So all of the other disorders in the DSM-5, we diagnose them regardless of any kind of situation that might be related to the onset of the disorder. For example, we know that depressive episodes might sometimes be preceded by stressful life events. We know that schedule disrupting events can be associated with increased risk for the onset of manic episodes, but those kinds of external events are not required for diagnosis. In contrast, all of the disorders in this category require exposure to a traumatic or stressful life event as part of their diagnostic criteria. These are the disorders that are included in this category in the DSM. Reactive attachment disorder and disinhibited social engagement disorder are both disorders of childhood that we observe in children who have experienced what the DSM calls insufficient care. So these are children who may have experienced neglect. They may have had very unstable living situations where they don't have consistent caregivers. They may have experienced childhood abuse, and these kinds of stressful experiences where they're not receiving sufficient care in childhood are associated with significant problems. In the case of reactive attachment disorder, we see behaviors indicating that the child is emotionally withdrawn and has trouble developing attachments and relationships with individuals. And in disinhibited social engagement disorder, we see the opposite. We see that the child is forming inappropriate attachments and is overly comfortable interacting with unfamiliar adults. We are going to focus on the three disorders that are primarily observed in adults. These can also be diagnosed in children, but we are going to focus on their diagnostic criteria and the way that they tend to present in adult populations. So these disorders include post-traumatic stress disorder, acute stress disorder, and adjustment disorders. So you already know from the video lecture about the symptoms of post-traumatic stress disorder that this disorder is characterized by symptoms that develop following exposure to one or more traumatic events. So we know that criterion A requires that the person has been exposed to a traumatic event. We also remember that this traumatic event needs to meet specific criteria in terms of how severe the event was and how the person was exposed to this event. After being exposed to this event, we know that a person needs to have developed symptoms in a number of domains, so they need to be experiencing at least one intrusion symptom. For example, having physiological responses when they're exposed to cues that remind them of the trauma. They need to have at least one avoidance symptom, so either avoiding thinking about the trauma or avoiding places or things that they associate with the trauma. They need to have at least two symptoms related to cognition or mood, so that might be things like having trouble remembering important parts of the event or a sense of a foreshortened future. And they need to have at least two symptoms of arousal and reactivity, so that might be things like having a hyperactive startle response. In addition to having all of these symptoms, there's a duration criterion, so the symptoms need to have been present for at least 1 month, and the symptoms need to be associated with clinically significant distress or impairment. So we can consider PTSD our prototypical trauma-related disorder. Acute stress disorder is also characterized by symptoms that occur following trauma exposure, but the primary difference between acute stress disorder and PTSD is that with acute stress disorder, the symptoms last from 3 days to 1 month following trauma exposure. So when an individual develops symptoms immediately after a trauma exposure, up through 3 days after the trauma, we wouldn't give that a DSM diagnosis, because if we think about the characteristics of criterion A traumas, we would consider the development of these symptoms within those initial 3 days to be a normal adaptive trauma response. Acute stress disorder allows us to give a diagnosis within that first month following trauma exposure when a person is expressing significant symptoms that are similar to what we see with PTSD and experiencing clinically significant distress and impairment. So just like PTSD, the person needs to be exposed to a traumatic event, and the criteria are the same as for criterion A traumas for post-traumatic stress disorder. In addition, the person needs to exhibit at least 9 symptoms from any of 5 categories. So these are very similar to the symptoms of PTSD. So these include intrusion symptoms, symptoms of negative mood, feelings of dissociation, so feeling disconnected from reality, avoidance symptoms, and hyperarousal. The duration criterion is the key difference between acute stress disorder and PTSD. So the duration of symptoms is between 3 days and 1 month after the trauma, and the symptoms need to be present for 3 or more days. So acute stress disorder can only be diagnosed within 1 month of the trauma exposure, and you need to see symptoms present for at least 3 days within that month to give this diagnosis. And in addition, the symptoms need to be associated with clinically significant distress or impairment. We also have another set of diagnoses in this category. This group is called the adjustment disorders. So adjustment disorders are diagnoses that we can use when a person develops emotional or behavioral symptoms in response to an identifiable stressor, and when these symptoms occur within 3 months of the onset of the stressor. So importantly, for adjustment disorders, you need to be able to connect the timing of the development of symptoms to the onset of the stressor. So the symptoms occur within 3 months of the onset, and if the stressor or the consequences of the stressor end, symptoms resolve within 6 months. If you continue to see symptoms persist longer than 6 months, not only after the stressor has gone away, but after the consequences of the stressor have gone away, then we might consider some other diagnoses. Importantly, the symptoms do not meet criteria for another disorder, and they also don't represent the exacerbation of a pre-existing disorder. So for example, if someone develops symptoms of major depressive disorder after experiencing a stressful event, we would give them a diagnosis of major depressive disorder instead of diagnosing them with an adjustment disorder. Similarly, if someone already has an anxiety disorder, for example, if they have social anxiety disorder, and they experience a stressor and their symptoms get significantly worse, we would not give them an additional diagnosis of an adjustment disorder. So if there's an existing diagnosis in the DSM that can be used to characterize a person's symptoms, we would not use this as an additional diagnosis. And then finally, the symptoms or behaviors that the person is experiencing in the context of this stressful event are associated with clinically significant distress or impairment. Importantly, that clinically significant distress or impairment needs to take that person's culture into account in thinking about what is culturally expected as a normative response to that kind of stressor. So is the degree of severity or impairment of the distress or impairment that a person is experiencing consistent with how they're typically expected to respond to that kind of particular stressor in the context of their culture? Or are they experiencing a disproportionate response to that stressor? There are a number of specifiers that are used to characterize the symptoms of the adjustment disorders to describe the kinds of emotional or behavioral symptoms that the person develops in response to the stressor. So one specifier would be an adjustment disorder with depressed mood, and that would be characterized by symptoms consistent with depression, such as low mood or social withdrawal or anhedonia, that don't meet criteria for a depressive disorder. You can also have adjustment disorders with anxiety, so those would be characterized by symptoms consistent with our anxiety disorders, like experiencing fear or worry, or physical symptoms like tension and difficulty sleeping. You can also have adjustment disorders with disturbances of conduct. Those might be characterized by aggressive or impulsive antisocial behaviors. And then finally, we have a specifier for unclassified adjustment disorders, where the emotional and behavioral symptoms that the person develops in response to the stressor don't fall into any of those other 3 categories. So thinking about the differential diagnosis of these trauma and stressor-related disorders, there are several important characteristics to consider. Compared to PTSD, acute stress disorder is primarily distinguished by its shorter duration, so 3 days to 1 month, versus PTSD, which requires that the symptoms have been present for at least a month. In addition, there's more flexibility in the distribution of the symptoms. So a diagnosis of PTSD requires symptoms in each of the 4 categories, versus a diagnosis of acute stress disorder requires at least 9 symptoms, but does not specify which categories those symptoms need to come from. In addition, compared to both PTSD and acute stress disorder, the adjustment disorders can be given as a diagnosis when the life event does not meet the criterion A definition of a trauma. So different kinds of stressful life events, for example, losing a job, having your children leave the house and go off to college, any kind of major potentially stressful life change that is not considered a trauma according to DSM criteria could be used as the stressful event in the context of a diagnosis of an adjustment disorder. And in addition, we have a wider range of potential symptoms and behaviors. So unlike those very specific trauma-related symptoms that we see in PTSD and acute stress disorder, in adjustment disorders, we might be seeing symptoms of depression, symptoms of anxiety, symptoms of uncontrolled behaviors, or combinations of those different kinds of emotional and behavioral responses.